exactly is sleep, and why is it important?
Sleep is actually a biological function. It's a function that's shared by all living creatures, even single-cell creatures that are present at the bottom of the ocean, as well as all the way through to human beings. It's actually very poorly understood outside of the realm of physiologists, people who study sleep, or sleep medicine specialists. And the reason it's important is that abnormal sleep or insufficient sleep, those two often coexist, can have a number of health impacts. That's only becoming apparent now in the modern sleep era, which began after about 1973. Prior to that, looking at sleep in human beings was just a curious and unusual pursuit amongst some scientific labs, but now it's a whole field of clinical sleep medicine.
And what is sleep medicine?
Sleep medicine is the field of study dedicated to illnesses, disorders, complaints that happen to the sleeping human being. And that can be from any age, from birth even until the very end of life. We can have sleep disorders that involve excessive sleepiness, we call them hypersomnias. A lack of sleep, we call those insomnias. Behaviors emerging from sleep, we call those parasomnias, or other sleep disorders. Sometimes sleep disorders affect sleep and wake. For instance, you've probably heard of restless leg syndrome that affects you when you're awake and also when you're asleep. So it's a very broad spectrum of both environmental factors and biological disorders.
Do sleeping patterns vary between cultures?
There is a tremendous variation, though more and more of our modernized world is unifying some of the common themes. In this country, we have a terrible deficiency for Americans to have the right opportunity to sleep. We have very demanding lifestyles. We have work duties that intrude into the part of the day when we need to be resting. People have multiple roles. They're parents, they're a spouse, they're maybe supporting an elderly parent, and they therefore chip away at the time that should be reserved for sleep because of the demands of society. Apart from the United States, probably Japan is one of the most sleep-deprived societies there is, and that's a lot to do with our 24/7 culture, which has really changed the amount of time that people can dedicate to sleep.
What kind of sleep disorders are there?
Perhaps the commonest sleep disorder that we tend to see at the moment in a sleep center is sleep-disordered breathing, and the kind of sleep-disordered breathing we see is obstructive sleep apnea. That's very much one of the most important sleep disorders to look after in Americans. But insomnia is also very problematic, and all told, about 1 in 3 Americans has a sleep disorder of some form. So we're thinking about 100 million people. Very few of them are properly diagnosed or treated. Sleep apnea can affect any age group. If it's detected early in life, some of the effects can be prevented and it can be completely cured. But generally, people are showing up when they're adults. And there are several hallmark features that are associated with sleep apnea. Snoring, we should all remember, is never normal. And snoring is very commonly a sign of obstructive sleep apnea. That's the sound that might bother you or might bother the person next to you when you're sleeping, which is caused by turbulent airflow when the airway narrows. And the airway is anywhere from the tip of the nose to the thoracic inlet. When that becomes narrow, the air traveling down the airway becomes very turbulent and it makes a sound. And that sound over years can damage the nerve endings in the upper airway and make it very floppy. So when patients have obstructive sleep apnea, during sleep their airway is relaxed and periodically closes. So the partner or the patient will see that they're snoring or hear that they're snoring or feel it, and then there will be gaps. The breathing becomes very erratic, and then the brain gets a signal to wake up. So the patients have very interrupted sleep, and the sleep is not restful. Consequently, they're sleepy in the daytime. That's a classic description, and that's the commonest one. And people associate that with overweight men, usually of older age. But actually, people of normal weight or below normal weight can also have obstructive sleep apnea. They too might snore, but they commonly will have sleep that's just not refreshing or sleep that's fragmented. And those are the patients that don't usually get detected unless they see a sleep specialist. There are many kinds of treatments that we can offer patients for obstructive sleep apnea syndrome. And at Winthrop Sleep Disorders Center, we offer the full range. The most common treatment at the moment in the United States is to give patients a device that helps them breathe during their sleep. It doesn't do the work of breathing. The patient can initiate the breath themselves, but it just keeps the airway open using a mask, something called a CPAP mask or machine, which is continuous positive airway pressure. And that inflates the airway. It's not oxygen. It just keeps the airway open. In our center, we also use, with the collaboration with dental sleep specialists, the oral appliance, which is a best way I describe it to my patients, it's kind of like a mouth guard, but it's custom made, and you insert it inside your mouth before you go to sleep to bring the lower jaw forward. And that's very carefully calculated with a board-certified dental sleep specialist, and that can treat mild and moderate obstructive sleep apnea. It can also treat snoring where there's no sleep apnea, though we don't often see that. And finally, there are a whole array of surgeries that are amenable to treating obstructive sleep apnea. The key with that, as with any of these treatments, is to know that you're seeing an expert who understands obstructive sleep apnea and that he or she is consulting with a specialized surgeon. And Long Island, we have a very special group that is expert in oromaxillofacial surgery specifically for certain people with obstructive sleep apnea. If you grow up with an airway that's narrow, let's say you're a child who's snoring and people don't really notice or don't know, it can actually change the shape of your facial skull and your skeletal architecture. So you're left with a permanent tendency to have a narrow airway during sleep. And once you know the clinical signs, they're easy to recognize. If we choose the right patients and have an experienced surgeon, he will plan multiple interventions that can actually rebuild and open up the airway inside the patient. The key is to make sure that we know what the expectations are, right, and that the patient is healthy for the procedure.
Tell me more about insomnia.
Well, insomnia is a very commonly experienced symptom. It should really be identified now as a disorder. And for a long time, the field of sleep medicine thought of insomnia as only a symptom to be treated briefly. In 2005, there was a State of the Science symposium that the NIH held looking at insomnia and realizing that insomnia actually wasn't just a symptom, like a fever, for instance. It was a full spectrum of disorders. And we know if we leave insomnia untreated, it can have lots of health consequences. Insomnia means trouble falling asleep or trouble staying asleep, or waking up before you really would like to, or sleep that's just not refreshing. All four components are part of the definition of insomnia. Sometimes patients can just have one, and sometimes they can have all of them together, and often one patient can have different manifestations. The causes of insomnia are multiple, and usually when we're seeing someone with chronic insomnia who's had symptoms for more than 4 weeks, they have more than one cause. So we need to take a very careful history. There's a systematic history that's taken, and then we evaluate their medical disorders, their medications. In this area, we practice in the tri-state area, as you know. There's a high number of shift work sleep disorders. And in this current economy, some people are trying to do extra shifts or being required to cover for a thinner workforce, or they're combining more than one job. All of those lead to certain kinds of insomnia. So it really depends on what each patient has as to how we might treat it.
What types of treatments are available for insomnia?
There are many different treatments. The important thing to know for people who might be watching this at home is that a medication is usually not sufficient to treat insomnia. And while there are many very good and FDA approved and American Academy of Sleep Medicine approved agents, without behavioral treatment and educational treatment, medications won't succeed. So we often see people who've been on a series of different medications and not having any luck at treating their insomnia arrive very discouraged and really with complications of untreated insomnia. We always start with education. We need to teach people what sleep is, what the mechanisms of falling asleep are, what behaviors are they doing that may be contributing to their sleep disorder. There's a whole field of sleep hygiene. So everybody here knows what dental hygiene is. Most people don't know what sleep hygiene is. And a lot of factors in our society actually predispose to very poor or insufficient sleep hygiene. So we begin with education, and then using the education, we help the patient change behavior. And then we may introduce medications that will help the patient cope with some of the aspects of their sleep. Occasionally, we have complicated patients, and we actually call in a subspecialist who's a behavioral sleep medicine expert in the area who collaborates with us with some of our most challenging patients so that we give them the best expert care.
Where can I get more information about sleep disorders?
I usually tell patients to go to the American Academy of Sleep Medicine or the National Sleep Foundation. Both those sites are reliable information and available if you Google them. You can also call us at 1-866-WINTHROP, and you can visit us on the web at winthrop.org, and you'll find lots of material about this.